Now, Donald Trump has a new pick for the Secretary of the Department of Health and Human Services. It is Georgia Congressman Tom Price. Now, if you're not familiar with who Tom Price is, he has been an outspoken critic of the Affordable Care Act, otherwise known as Obamacare. Now, look, that's not a surprise. Donald Trump ran on, hey, let's repeal and replace Obamacare. Let's get rid of it. Then, of course, after he talked to Obama a couple of times, he was like, oh, well, maybe we'll keep a couple of pieces of Obamacare. It's not so bad. But now, unfortunately, he picked someone who for sure wants to destroy it. Get it, scrap it, eliminate it. Great. Now, Price does have a plan to replace it. Let me give you a provision here from it. His plan would instead offer fixed tax credits pegged to a person's age rather than their income, so that they can essentially buy their insurance policies on the private market. Here's a, here's a tax credit. Have at it, man. See, here's the problem with tax credits. They don't do anything for poor people. If they're already too poor to buy insurance in the private market and to pay taxes, well, then how are they going to benefit from this and get insurance? The answer is, well, they're not. They're not going to get anything. But anyway, I'll get to the other recourse that is also going to be lost for poor people. But first, according to the Fiscal Times, the tax credits would be fairly modest, ranging from about $1,200 a year for people 18 to 35 years of age to $3,000 for those 51 and older. So seniors, people approaching their senior years, you get $3,000 in tax credits to buy insurance. Something tells me I don't think that's going to cover. Just saying. And look, in getting rid of the rest of Obamacare, of course, Price would repeal the expanded Medicaid coverage that is in effect in 32 different states in the District of Columbia. So that's it. I mean, poor people who were too poor to buy insurance, sorry, you're just going to be left with tax credits, which you don't pay taxes on anyway because you're too poor to pay taxes, and you get normal Medicaid. Well, you're fucked. Essentially, don't ever get sick. Now, also, first, what I'm trying to say is that everything to deal with Obamacare, everything that's good about it, gone. There's plenty of stuff that was not good about it and stuff that needed to be fixed. And look, that's why I supported single-payer healthcare, because it would have fixed those specific issues. But now, he's getting rid of all of it. Obamacare, done. Medicaid, done. But that's not the worst of it. He's also coming for your Medicare. See, Tom Price, just like Paul Ryan, is planning to privatize Medicare. Basically, boiled down to the simplest, he's going to privatize it and then give states a block grant. And basically, from there, the states will give seniors and anybody who was on Medicare a coupon in order to buy insurance in the private market. That's the Paul Ryan plan. But wait a minute. I thought Donald Trump promised that he wasn't going to touch Medicare or Medicaid at all. He was going to keep them the same because those are programs that worked. Turns out, no, he's not. And see, I think I know why Trump changes his position so often. It's because he listens to whoever's in the room. Whoever's around him, he's like, oh, yeah, it's a great idea. I mean, for example, he talked to Obama and said, oh, yeah, those are actually good ideas. Pre-existing condition. Okay, that's great. Yeah, okay, I'll keep that. Yeah. And then some far right winger walks into the room and says, hey, you should put this guy in your team. He wants to get rid of Obamacare. Oh, yes, sir. That's a great idea. Awesome. And now, as I said, Obamacare, gone. Medicaid expansion, gone. Medicare, privatized and given to the states over in a block grant. And you can bet that in Republican-controlled states, which unfortunately is in the majority at this point, that money, that's not going to go to healthcare. No, what it's going to do is when you block grant something to the state, you're essentially saying, here you go, spend it on whatever. We would like you to spend it on healthcare because that's what it's for. But, if you decide that you need to plug your budget hole because you just gave massive tax cuts to rich people, well, we go ahead and use that for it too. We don't care. That's your money. And see, that's how they play this game. That's why you're always hearing, no, turn it over to the states, turn it over to the states. Because most states are Republican controlled. And they love this block grant system so that they can go and they can plug their budget holes after giving giant tax cuts to very, very rich people and corporations and say, see, we balanced our budget. We're going to get elected again. Here we go. Now, when asked to the changes to Medicare might come, Price told Talking Points memo, quote, I think that it's probably in the second phase of reconciliation, which would have to be in the fiscal year of 2018 budget resolution within the first 6 to 8 months. So very, very soon. Oh boy. And with the Republicans controlling everything, it is likely to get through reconciliation. All you need is a simple majority vote, which is what the Republicans currently have. Goodbye, Medicare. And look, Republicans like Tom Price and Paul Ryan, Mitch McConnell, they couldn't wait to get rid of Medicare and turn it into a voucher system. And it looks like that's what they're going to be able to do. And look, it's not just Medicare. Obamacare, it's not all about that. There are also other horrible things about Tom Price. Now, we all know that he's an incredibly conservative, hardcore right-winger. And now we also know that he's going to be pretty bad for women's health as well. In 2005 and 2007, for example, he co-sponsored 2 personhood bills known as Right to Life Acts, which would have granted zygotes, full legal protection under the Constitution from the moment of fertilization. So this guy, hardcore right-winger, hardcore pro-lifer. Basically, what that would do, this bill would effectively ban both emergency contraception and abortion. Full stop. Now, he also voted for the so-called Pain-Capable Unborn Child Protection Act in both 2013 and 2015, which would have resulted in a nationwide 20-week abortion ban. In addition to being against abortion, being anti-choice, he's also opposed to giving people free birth control, which studies show reduce abortion. That makes sense. You allow people to have birth control that's readily accessible. Yes, you're going to reduce unplanned pregnancies and abortions. Now, he told Think Progress in 2012 that there are no women who struggle to afford birth control and that the ACA's contraceptive mandate is wrong. He said, quote, bring me one woman who has been left behind. Bring me one. There's not one woman. Oh, really? There's not. Well, there was a report that went along with this that found that more than a quarter of U.S. women and 44% of low-income women who use birth control get it from publicly funded clinics for free. Oops. He says, he continues on this by saying, the fact of the matter is, this is a trampling of religious freedom and religious liberty in this country. How dare you get free birth control? You are trampling on my freedom. Don't trample on my liberty by getting your free birth control. These are the same people that complain about mothers on welfare that had unwanted children that they couldn't afford. Well, how are you supposed to avoid that? But this is a Republican plan of, let's punish women who have sex. Poor women who have sex. And the rich women, they're not punished at all. Because they're wealthy, they can afford contraception. But poor women, you're fucked. Literally. And what happens when you get raped? Or if there's an incestuous relationship? You're fucked too on that one. So there's more. In 2013, Price voted in favor of the Blackburn Amendment, which would have allowed insurers to opt out of covering preventative services for women. Now we're talking about stuff like cancer screenings and pap smears. And yes, including birth control without cost sharing on the basis of religious or moral objections. I morally object to doing a pap smear. Sorry, can't do it. And he thinks employers should be allowed to fire workers, female workers, for using birth control. Basically, he opposed a 2015 Washington, D.C. non-discrimination law that would have prevented employers from firing workers for using birth control or having an abortion. So that's what this guy stands for. And finally, of course, like a lot of Republicans, a lot of these social conservatives, he has been firmly noted as wanting to destroy Planned Parenthood, basically eliminate their funding. In fact, he introduced a 2015 budget reconciliation bill that would have repealed, of course, Obamacare and barred Planned Parenthood from receiving federal family planning funding. In 2011, he supported a resolution that would have completely eliminated the federal-funded Title X family planning program, barred Planned Parenthood from receiving Medicaid reimbursements, and reinstated the global gag rule, which prevents groups that receive U.S. aid from providing abortions or counseling patients about them. So there he is against Planned Parenthood, which, look, 3% of what they do are abortions that are not federally funded. Something called a Hyde Amendment exists to prevent that in most cases, except for rape and incest. And I think that's a very fair compromise in that. But no, just eliminate all of it because we think you're doing barbaric abortion practices that are not federally funded. So let's remove all your other funding for all the great stuff that you do. This is where we're at, man. Not only is this guy against Medicare, Medicaid, Obamacare, he's against birth control, he's against women's rights and autonomy. And this, unfortunately, this is the future of the this is the future HHS Secretary. If you're old, if you're sick, you're poor, or you're a woman, or any combination thereof, well, then it looks like under this guy, under Donald Trump, you are not going to be doing very well. Stay healthy as much as you can. Don't get sick. Because if you do, you're fucked. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent, non-corporate media, go to our Patreon page and become a patron. Patreon.com/TYTNation.